Hi, good morning, everyone. My name is Marquette Lowe, or actually, good afternoon. My name is Marquette Lowe. Like Heather said, I'm an LVN case manager who works with individuals managing chronic health conditions. I work for Health Texas. I've been an LVN for the past 13 years. Outside of being an LVN, I do have a 3-year-old son. He has autism, so we are very busy when I'm not working. Today, we are recognizing National Migraine and Headache Awareness Month. Many people think migraine is simply a bad headache. In reality, migraine is a neurological disease that affects adults and children and can significantly impact school, work, family life, and mental health. Throughout today's,
Did you go to the next slide?
no, I did not.
Okay, just want to make sure. Sorry.
Okay, thank you. Throughout today's presentation, we will discuss what migraine is, who it affects, common triggers, and how each of us can support those living with the conditions. And it's funny enough, I actually have a migraine right now, so I have to practice a lot of what I am about to preach. So, by the end of today's session, you will be able to identify common migraine symptoms, recognize common triggers, understand the impact on children and adults, identify workplace and school accommodations, and most importantly, know when medical attention is needed. So, my goal here is to provide practical information that can be applied immediately in your personal and professional lives. Migraine is among the leading cause of disability worldwide. People often continue working and attending school despite symptoms. This invisible illness affects productivity, attendance, relationships, and quality of life. Many people suffer in silence because they fear others will not understand what they are experiencing. Or, they do experience and people are just kind of like, oh, it's a migraine or it's a headache, not that big of a deal, and in fact, sometimes can be a very big deal. Migraine is a neurological disorder involving complex changes in the brain and nervous system. Symptoms often include moderate to severe headache, nausea, vomiting, sensitivity to light, sensitivity to sound, and difficulty concentrating. Attacks may last several hours to several days. Not all headaches are migraines. Tension headaches often feel like pressure or a tight band around the head. Cluster headaches are extremely painful and typically occur around one eye. Secondary headaches may be caused by injury, infection, or another medical condition. Understanding the difference helps guide appropriate care. So, how common is a migraine? Approximately 15% of women and 6% of men are affected annually. Headache disorders affect over 1 billion people globally. So, it is very common, unfortunately. Who's impacted? Teachers, janitors and maintenance staff, administrative staff and secretaries, paralegals and attorneys, judges, children, and adolescents. And really, honestly, anyone and everyone can suffer from these things. Migraine across the lifespan, so it can happen as a child, adolescent, adult, older adults, and then hormonal influences across life stages. So, symptoms we should be looking out for: pulsating headache, nausea, vomiting. It doesn't have to be both, it could be one or the other. Dizziness, light sensitivity, sound sensitivity, visual disturbance. So there's something called an ocular migraine, which is a visual migraine that is a migraine with aura, usually affects one or both eyes and lasts 10 to 30 minutes, may occur with or without headache. Triggers can include stress, bright lights, or lack of sleep. Typically not harmful, but can feel very alarming. It's very important that you seek care if symptoms are new, severe, or persistent. So, what exactly is an aura? Visual changes, flashing lights, zigzag lines, temporary blindness, tingling or numbness. I know for myself, I get like the little floaters. They're almost like black dots that sometimes appear, and then I know, okay, a migraine is starting to come on, let me go ahead and lay down. The picture on the right kind of shows, just the visual changes that might seem to happen. And it's, of course, if you're driving, important to pull over. Um, if you're unable to lay down, but just making sure that you're in a safe place once the vision starts to change. Migraine triggers overview. Triggers vary by individuals. Multiple triggers may combine to provoke attacks. So lifestyle triggers. If we're skipping meals, sometimes we have that long work day, can't eat. I'm a nurse and I used to work out on the floor, and just didn't have the time to take a lunch. That can, of course, cause a migraine. Dehydration, not getting enough fluids in, sleep deprivation, and even oversleeping, shockingly enough, can also contribute to a migraine or a headache. And then, of course, the big one is stress. Environmental triggers. So sometimes if the lights are too bright, where we work, we actually have the lights off and then we just have our overhead, for the computer because a lot of us there suffer from migraine. So it really helps. If there's a glare, noises can be triggers. Weather changes can be triggers. Strong odors. I know myself, I cannot have too strong of perfume, or I'm for sure going to get a headache, or like a loud scented candle, I'm definitely going to get a headache. Food and chemical triggers, so caffeine, food additives, nitrates, alcohol, are also going to be triggers as well. And then we have our hormonal triggers. So for women, our menstrual cycle changes, and then high prevalence in women. Stress and migraine. So, the typical work stress, school stress, family stress. Even actually positive events can trigger attacks because, sometimes, say like someone's graduating, that's a positive time, but maybe you have a lot of things to do to get ready for that. And then unknowingly it's creating stress and then it triggers a migraine. Brain science of migraine. So involves trigeminal pathways, CGRP activity, sensory hypersensitivity, complex neurological mechanism. Migraine types, migraines without aura, migraines with aura, chronic migraines. So a chronic migraine would be a migraine that you get at least 15 times, a month or day. So, um, just in, a 30, 31 day calendar, if it's happening more than 15 times, that's considered chronic. A migraine features on at least 8 days of the month. Major impact on quality of life, right? Because if you're getting this migraine that many times, surely it's affecting, your daily living. And then it's very important at that point you speak with your provider and then you guys come up with a plan of care, whether it's, preventative medication or just things that you should be doing at home, which I'll get to those things as well. Workplace study, I'm sorry, impact on work. So reduced concentration can cause you to miss work or, leave work early, lower productivity. When you're having a headache, it's harder to think and focus. So, definitely an impact on work. Workplace study findings, education improves awareness, reduces stigma, can improve productivity and support. And one thing I don't think I put in here, but I do want to mention is, it's very important that we have, um, an updated vision exam. If you struggle with your eyesight, if your vision exam is outdated and you're wearing, older glasses or contacts, it can also cause headaches because there needs to be some adjustment made. So, the hidden burden. Many continue working despite symptoms, often misunderstood by coworkers. Migraine and mental health, can cause anxiety, depression, stress burden, social isolation. Migraine and stroke. Migraine with aura associated with increased ischemic stroke risk. Risk assessment and medical care are very, very important, especially if you're starting to notice that these things are happening common. Children and migraines. So, just like all of us, children can experience migraines. Symptoms may include nausea, vomiting, abdominal pain, light sensitivity. It might be a little bit harder to determine with a child depending on the age of the severity of their migraine. Of course, we have the 0 through 10 chart, and then we also, for the children, have the FACES chart. You can Google and show them as well, just to kind of ask them, like, how are you feeling? Because sometimes it's a little bit harder for children to express. But it's good to know those symptoms because then maybe you can ask them like, hey, are you seeing little dots or do you feel like you need to throw up? And just definitely technical terms for the kiddos. Migraines in adolescents, symptoms become more adult-like, may affect academics, attendance, and social activity. Warning signs in children. So headache after injury, sudden severe headache, fever, neck stiffness, confusion, balance problems. If any of these things happen, this is definitely time to seek medical attention. Helping a child during a migraine. So you can take them to a quiet, dark room, lay them down, cool cloth over their head, encourage sleeping if, it's a good time and they're able. And then, of course, following healthcare provider recommendations. Preventing childhood migraine. So, regular meals, hydration, adequate sleep, stress management, identifying triggers. So, with that's going to be the same across the board, no matter what age you are. Of course, specifically with children, but I would encourage that for all ages. Headache diaries. So we can track the time. If you're starting to notice that you're getting a headache or a migraine, start tracking the time, the types of foods you're eating, the activities, your symptoms, and response to treatment. So that way you can start to pinpoint and you can understand and possibly figure out what your triggers, like, oh, is it the loud noise or the strong smells or the light? And then that way you can try to avoid those things as much as possible. Role of teachers. Recognize symptoms, allow rest breaks, reduce sensory triggers, communicate with parents. And especially if, we have teachers on here, and then also, just for your students or your own children, just making sure the teacher is aware that they are experiencing headaches or migraines so they can allow those extra rest breaks if needed. Role of school staff, provide supportive environment, reduce stigma, no emergency warning signs. Role of parents, advocate for your children, track triggers, coordinate care, promote healthy habits. Supporting employees, flexible accommodations, lighting consideration, hydration and breaks, understanding, and empathy. Support for active workers such as janitors, maintenance, and staff on their feet may need hydration, scheduled breaks, and trigger reduction. I know, especially, too, for people that work outside, it's a lot more common for them to get headaches as well. Support in legal and office settings, screen glare management. They have those things you can order on Amazon to place over your computer. I think they're geared for like privacy screening, but also it can help lower the risk of the migraine and headache. Quiet workspace options, scheduling flexibility during attacks, reducing stigma. Migraine is a neurological disease, invisible illnesses are real, support improves outcomes. So, when to seek medical attention? Sudden severe headache, neurological deficits, headache after trauma, new headache patterns. So, if any of these things happen, or really you're unsure, or you just notice that it's happening frequently, please follow up with your primary care provider. If you do not have a care provider, we can certainly help you get one. Key takeaways. Migraines affect all ages. Children are impacted. Triggers are manageable. Support workplace and school matter. And that's it, guys. I did have some questions come in that I'll go over right now. So someone asked, does my magnesium cause headaches? So migraines versus magnesium. Magnesium usually does not cause headaches. In fact, it's often used to help prevent them. Magnesium is a mineral your body needs for nerve and muscle function. Low magnesium levels are actually linked to headaches and migraines. Supplements may reduce migraine frequency for some, and on rarely occasions, very high doses can be a side effect, have side effects like diarrhea, but headaches are not usually a common side effect directly related to magnesium. Another question is a sharp poking pain on the lower left side, back of the head, lasting maybe a second, but happens frequently a stress headache. So the type of pain is not typical of a stress tension headache. Stress headaches are usually dull, aching, and last longer, like minutes to hours. Stress headaches usually feel more like a constant pressure. A quick, sharp pain in one spot that comes and goes is often a different type of headache and usually not serious, but as always, it's a good idea to mention it to your provider just to make sure that we're not missing anything. What do you do when you wake up with a headache from last night? So I'm sure we all have, you know, went to bed with a headache and then you woke up the next morning and it's still there. I recommend drinking water. You could be dehydrated. Try a small amount of caffeine, coffee or tea, like coffee or tea. Of course, over-the-counter pain relief, Tylenol, ibuprofen. There's Aleve, Excedrin. There's different things and different ones work for each of us. I know for me, Tylenol doesn't really work. So just kind of figuring out what works for you. Eat something light if you haven't eaten already. And then if time permits, rest in a quiet room. And then gentle neck stretches can help as well. When to follow up with your provider happens often in the morning, could be sleep issues. We sometimes grind our teeth, or it could be related to blood pressure. Follow up if headache is severe or unusual, and then not improving with usual remedies. So we never want to ignore these things. We definitely want to follow up with our provider because, again, it could not be a headache. It could possibly be a migraine, and then you might need to be on medication for that. There's preventatives, and then there's also that you take daily, and then there's also some that you just take as the migraine comes on. You start to learn your triggers, and then you'll go ahead and take them to reduce the pain. What options do I have for migraine pain? Do I really have migraines or do I have muscle tension and TMJ headaches? So, not all headaches are migraines. Migraines tend to have throbbing pain with sensitivity to light or nausea, while tension and TMJ headaches feel more like pressure or jaw-related pain. The treatment depends on the type, so it's important to talk to your provider if you are unsure. The biggest thing I want to stress with all of this is if you are someone that is suffering with a headache or migraine, and you haven't already spoken with your doctor, or maybe you have and the medication's no longer working, or maybe you guys came up with household things to do, like the drinking the water, stretches, all of those things. If it's not working, you're seeing that they're still consistent, definitely talk with your provider. In some cases, even you need to have an MRI done and just making sure that you are taking care of yourself. Do I have any questions?
So if there are any additional questions, you can take yourself off of mute to ask, or you can ask the questions in the chat. No, ma'am. It doesn't look like we have any questions at the moment.
Alrighty, well, thank you guys so much. We hope to see you guys at the next health talk. Have a great weekend.
Thank you guys for joining us. We greatly appreciate it.